So all we're going to do today is go through anatomy a little bit and talk about injection techniques. A little bit about myself. I'm a dental surgeon. I graduated from King's College London. And I also currently teach at King's College London as well. Every day during practice, as Bob mentioned, we see a lot of patients who have dental problems. One of the biggest problems that I see every day is tooth wear. A lot of these patients who attend with tooth wear grind their teeth at night or during the day. They are constantly exercising their muscles of mastication. Two of the big muscles are temporalis and masseter muscle. So when they come to you, they present sometimes with big temples and more commonly a square jaw. This is one of my colleagues. She's a dental surgeon herself. She grinds her teeth. When you look at her face, she had a big square jaw, in addition to a lot of pain and headache. We treat these patients with botulinum toxin. Not only their face and facial contours improves, their pain also reduces. So what I'm going to talk about to you today is we're going to talk about mouth frowns, smoker lines, square jaw, sad mouth, orange pill chin, and gummy smile. Common terms. There is no medical terms there, and we're going to keep the presentation very simple. I'm not going to talk about botulinum toxin to you. You're all very familiar to it. You're familiar to the toxins that you normally use. It is very important to know how much your toxin spread, how much you're using, and what kind of toxin you're using. The first thing I'm going to talk about is perioral lines, the smoker lines. When patients present to you with smoker lines and they seek treatment, do you normally treat them with botulinum toxin or with fillers or combination treatment? Botox? Combination treatment. Does it matter what age your patient is? Yes, young patients, smoker lines, usually botulinum toxin works very well. But when you have patients who are above 35, they normally have volume loss in addition to hyperactivity of orbicularis oris. So it is very important to treat them with combination of botulinum toxin and dermal fillers. It is important when we're treating lower face that we use conservative dosage. We have a lot of muscles. They are thin muscles and they're very close to each other. Spread of muscles can result in asymmetry of your patient's lower face, their smile. It can affect their speaking. Musicians, singers, and speakers, please be mindful. If your patient is someone who is a musician who plays wind instruments and they are attending to treat their perioral lines, it is important to tell them that it will be difficult for them. People will not be able to use straws very easily. And these are the things that you need to warn your patients about. Technique. All we're going to do is very simple. Make sure that your injection points are symmetrical. We want to stay away from the corners of the mouth. We want to stay away from the philtrum. Philtrum flattening is not aesthetically pleasing. We always build up the philtrum with dermal fillers, therefore we want to stay away from it. Stay away 1 millimeter and you will be safe. Depending on your patient, you can have 1 injection point or 2 injection points. You do want to be superficial here and use very conservative dosage. If you under-inject, your patients will come back to you. You can correct that. But if you over-inject and your patient has lip incompetence or asymmetry, then they will not be happy. Sad mouth, drooling corners of the mouth. How many times a day, out of 10 patients, how many patients come and attend our practice just because they're very upset about the corners of the mouth? 7 out of 10, 8 out of 10. I personally would used to do previously, because I was taught, would do dermal fillers all the time. And then I realized, okay, there's something wrong. I am using dermal fillers. I am not getting the results I desire or the patient desires. It is due to hyperactive depressor anguli oris muscle. It is working against the elevator muscles of the corners of the mouth, zygomaticus major and minor. Treating these muscles is a little bit difficult. It's not as easy as you would have thought so. It does make your patients look sad, tired, and angry. The complications can be drooling, incompetent mouth, difficulty speaking, asymmetrical smile, and I am going to explain why these things can happen so you can prevent it. This is a very, very good study. This study was, it took place in Korea. They studied the depressor anguli muscle. Do read the paper, it's a very good paper. In front of your DAO, what you have is your depressor labially inferior muscle. You don't want to inject that muscle. Lateral to that muscle, also in injecting lateral to it, you can affect your zygomaticus muscles, you can inject risorius muscle. Therefore, we want to stay away from it. A very simple technique, find the modulus, draw a line. These patients were Asian patients. In Asian patients, modulus are normally a little bit lower than Caucasian or African patients. Therefore, it was about a little bit lower than we would normally find it. Find the modulus, draw a horizontal line, and then a vertical line to the angle of the mandible. What you want to do is you want to be less than 30 degrees medial and less than 45 degrees lateral. Usually placing your injection point inferiorly is better. As you can see, it's fan-shaped. If you get a little bit of spread, you're less at risk of causing asymmetry or any problems for your patients. Going a little bit higher up, having a look at this picture actually. Can you see this patient? She's getting a lot of puckering when she's turning the corners of her mouth down. This amount of puckering with one injection point is normally not taken away completely. So what you can do is put 1 unit or half a unit a little bit higher to get rid of this sad mouth. Another thing you can do is draw a line, a vertical line from nasolabial, perpendicular to the mandible, and what you want to do is just be medial to that, and then you'll be safe. 2 to 4 units of Botox per side, and what you want to do is you want to, if you have a 13 millimeter 30 gauge needle, you want to go halfway in. Dimpled chin. How many here treat dimpled chins? 4 or 5. With Botox or fillers? Here again, indication for a treating mentalis, and this area is a combination treatment. Because here not only you have a hyperactive mentalis muscle, you have lost collagen, you have lost subcutaneous tissue. And combination of both together results in this appearance of dimpled chin. Young patients don't get this because they haven't lost collagen, they haven't lost their subcutaneous tissues. Therefore, combination treatment is recommended here. Injection is very simple, 2 points. For your mentalis muscle, you go all the way in with your 13 millimeter needle, 2 to 4 units per injection site. I cannot emphasize how important it is to undertreat lower face than overtreat lower face. Your patients can have incompetent lips if you overtreat this area. They can have drooling, speech impairment, asymmetry, and lower lip ptosis. Therefore, it's important to undertreat, get them back, review them, and re-inject if you require to. Gummy smile. Who treats gummy smiles? And do you find that you had to change your technique a few times till you get it right? This is the technique I use, but please do share with us your experience of treating gummy smile, because it's something that we very commonly see in dentistry. It is something that concerns patients. They do not like it, and they come for treatment of gummy smile. Treating gummy smile is not as easy as we think it is. It is very important to understand whether the problem is skeletal, is dental, is due to patient's gingiva, or it is a true hyperactivity of muscles. If it is hyperactivity of the muscles, yes, we can treat it. If it is not hyperactivity of muscles, yes, you will reduce their appearance of their gummy smile, but they will have a flatter smile when they smile, and you haven't got rid of their gummy smile, so they may not necessarily be very happy. When we're treating gummy smiles, what we're going to target here is our 3 elevators of the corners of the mouth. We're going to treat the levator labial superior. We're going to treat the nasi and zygomatics minor here. Again, this is a very good study. I recommend you read the paper. What they have done is they've studied 45 cadavers to find out where exactly we can find all these 3 muscles overlapping, so we can inject that area without compromising a patient's appearance and their lower face shape. By looking at the cadavers, what they found is there's a little triangle here just lateral to the ala. This little triangle is where all these 3 muscles overlap. By injecting here, you will get a little bit of spread, and the botulinum toxin will spread to all these 3 muscles. Your gummy smile will improve. What you want to do is go 1 centimeter lateral and draw a vertical line to that 1 centimeter horizontal line that you've drawn and inject there. Your injection point is medial and you want to have a deep injection there. 2 units is normally sufficient. Under treat, get them back if they need to treat. This was a case study that was in this paper. I have used it, it works very well. Masseters and masseter hypertrophy. Again, if you're a dentist or not, check your patients for masseter hypertrophy. It is very common for your patients to come with a square face to you and they want cheek enhancement, or they don't really know what's going on with their face. They know the shape of their face has changed, but they're not aware of what exactly has happened. Ask them if they grind their teeth, palpate their masseter muscles. This study is another very good study. What they did in study was they studied position of parotid, the parotid gland, parotid duct, and veins and facial vein and artery to see where the safest zone of injection is. The conclusion was draw a line from lower. I know soft tissues are not the best reference points, but from the earlobe to the chilion, underneath this line, when you inject, you're safe. You want to stay away from the medial and the lateral part of this line and stay 1 centimeter above your border of the mandible. 3-4 injection points, it really depends on your patient. It is important to understand the muscle you're injecting, how big it is, whether the muscle is bulging once, twice, or 3 times. Inject at the highest part of the bulge, and you can inject 10 units per site. I normally inject 25 to 30 units per site and get patients back and review them in 2 weeks' time. If masseter is still very hyperactive, then I will go back and inject. And this is the kind of results I get with patients. This patient we treated twice, 3 months apart, and her masseter hypertrophy has gone away completely. I've been told I have 2 minutes. Thank you.
Thank you very much. Lovely. Thank you so much.